Hello and happy Valentine's Day to everyone who's joining us. Welcome to Live and On Call. My name is Allie, and as always, I am your host for today's discussion. We haven't had a Live and On Call episode in quite a while, but we are back with the first one of 2024, and it's fitting that today's topic is heart health on Valentine's Day. So, if this is your first time joining us, know that Live and On Call is a live streamed interactive conversation where we bring memorial physicians live and on call right to your computer, tablet, phone, or wherever you're viewing this video. So, again, this is an interactive video. We welcome questions and comments. We will have a little bit of a discussion beforehand with our guests, and then feel free during the chat if you think of questions or comments. You can go ahead and drop them in the comment section below. Or if you feel more comfortable, you're welcome to direct message us on Facebook Messenger during the live stream, and we will be checking those as well. At the end of our discussion, we'll get to those questions. So don't be afraid to ask a question. That's why we're all here. We are live and on call for you today to talk about heart health. So today's topic, here with us is Dr. Ahmad Awan, an interventional endovascular cardiologist with Memorial. Dr. Awan, you are live and on call. Thanks for joining us today.
Hi, good afternoon, and thanks for having me.
I'm excited to learn a little bit about how we can show our hearts some love. Like I said, today's topic's pretty fitting for Valentine's Day. So,
Yes, it is.
speaking of Valentine's Day, do you have a special Valentine that you're celebrating with today?
Yes, I have. It's my wife Myra, and I would like to wish her a very happy Valentine's Day.
Oh, that's awesome. I hope you got her some flowers or some chocolate or something nice. She's a lucky
Uh,
gal.
Hopefully, I will.
So, do you mind kicking us off a little bit and share a little bit about your background, what led you to this point as a physician, and what led you to choosing cardiology?
Sure. I am originally from Pakistan, and my father was an internal medicine physician, and he had been my role model growing up. Seeing how he helped the patients when they were at their most vulnerable was what I aspired to do. And that's why I became a physician and I started to do internal medicine residency following his footsteps. However, later during the residency, I fell in love with cardiology. I felt that in cardiology, I'm more able to help patients at an individual level as well as community level. And after that, I did 1 year of interventional cardiology and 1 year of endovascular intervention. And here I am now in Southwest Louisiana.
Awesome. Well, tell us a little bit about the patients that you see come through your door. What conditions do you treat?
So I treat coronary artery disease, which is disease of the arteries that supply blood to the heart. Treat disease in the peripheral arteries, which is the artery that supply blood to the leg and other part of the bodies. I'll treat aortic aneurysm disease by minimally invasive procedure, in which the big artery of the heart is enlarged and is a risk of rupture. Additionally, I also do medical management of heart failure and arrhythmias.
All right, so everything heart and vascular. Awesome.
Pretty
So,
much.
so as we talk about heart health, a very common consequence to poor heart health is the possibility of a heart attack. Could you tell me a little bit about physically what's happening when a heart attack occurs?
Sure. What happens is in the arteries that supply blood to the heart, there's gradual buildup of plaque, and which cause narrowing of those arteries. At some point, that plaque rupture and cause you a heart attack. So your heart does not get enough blood supply. So what we do to treat that condition is, as soon as the patient comes to the hospital, we take them to the cath lab. We go either from their wrist or from groin all the way up to their heart because all the arteries are connected. From there, we go with a wire and a catheter and engage those arteries. We initially shoot some dye that light up the vessel and show us where the blockage is. And then we open those blockage with a balloon and then put in a stent. So that helps relieve the blockage, but that's taking care of part of the problem. The other major part of the problem is disease everywhere else in the arteries, and we treat that with medications and lifestyle changes.
Gotcha. So when someone says that they've had a heart attack or they're told they're having a heart attack, it doesn't necessarily mean that the heart is stopping, right? It's just there's a forced
Yes,
ventilation issue. Is that right?
yes, that is exactly true. That means the heart is suffering some damage from blockages in the heart. Heart is still working. Heart has basically three main arteries, and even if one of them is blocked, you will get a heart attack. And that doesn't mean heart has stopped working. It's not working as much as it should, but it's still working. When the heart completely stops, it's called cardiac arrest, and that sometimes can also happen with heart attack. And that's a very serious condition. And even then, people, when they come in and we revascularize their artery, that means when we open up their artery, they still have a chance of survival.
Gotcha. So tell me, what are some symptoms, some common symptoms? I know, you hear people talking about maybe pain down their arm, or um, what are some common things to look for? And also, how do you know if it is an actual heart attack symptom?
So the classic heart attack symptom is chest pain. People describe it as a sharp pressure-like chest pain, like elephant sitting on their chest. And most commonly, they make this sign, and this is called Levine sign. And this pain radiates to the most commonly to the right arm and jaw. However, not all patients present with typical chest pain. Sometimes they present with shortness of breath. Sometimes they present with indigestion or burning. Sometimes they just present with fatigue. When they come to the hospital, what we do are two things. One is to do the EKG. An EKG will show us what's going on in the heart. The second test we'll do is called troponin, which is a marker of heart injury. And whenever you have heart injury, that marker will go up. It doesn't necessarily mean that you are having a heart attack, but it points us towards the direction, and we take the whole picture into account: patient risk factor, patient chest pain, and troponin and EKG, and then decide about what's the next step to do.
Gotcha. So I've heard, and then you can tell me if this is true or not, that sometimes heart attack symptoms can present differently in men than women. Is that true?
That is true. Like the most of the studies that were done initially were done with predominantly white male population. However, they were underrepresentation of women and elderly male, and sometimes women present differently. And that's as there are studies that have shown that women are often undiagnosed because they do not present with typical symptoms. They sometimes present with indigestion-like symptom. They present with dyspnea on exertion. Like my mom, when she had a blockage in the heart, she did not have any chest pain. She had dyspnea on exertion. She walked a block and she had like severe dyspnea. So sometimes the elderly male, they present with fatigue and tiredness. So especially diabetic patients, like they present differently. They present with shortness of breath or uh, sometimes indigestion. So you heard it totally right.
Good, good. So, um, what about a younger individual versus a older individual? Is it out of the question that a younger individual would have a heart attack, or is it typically in older people? How do you
So
see
it's,
that?
I mean, most commonly, most of the risk factor for heart disease, uh, they take some time, and mostly it's initially considered the disease of elderly. However, we are seeing it more and more in patients who are young, and most importantly, it's because of uh, their genetics. And there's a condition called familial hyperlipidemia, in which you have high cholesterol because of your genetics, and that leads to an increased risk of heart attack, especially in young people. And for young people, it's mostly genetic etiology. For elderly patient, it's other etiologies like high blood pressure, high cholesterol, diabetes, and these are the different risk factors that are in young versus. This is the difference between risk factors between young and elderly population.
Do you have any examples of any young patients that you've treated that may have been
Plenty
out of
of them. Yeah, there are plenty of patients we have treated. We have young patient who presented with a V-fib arrest. He actually his heart actually stopped because of blockage, and he was just 32 years old. And we opened his artery, and he did well. And I saw him back, and he was doing perfectly fine now with medications and medication and therapy.
wow. You said 22 years old?
32.
Oh, 32. Wow. Okay.
Yeah,
But still,
that was the youngest I treated, but I have colleagues who have treated patients in their 20s.
yeah. Wow. Well, just a reminder for those of you who are joining us, if you have any questions, please feel free to put them in the comments or send us a message as we keep going here. So tell me, what's the first step in recognizing maybe I might be having a heart attack? How long do you wait to go seek medical care? What is the a norm for that?
I always tell my patient to listen to your body. If your body is telling you something is wrong, listen to it. Do not ignore it. Especially if you're having chest pain or shortness of breath. These are the signs that you should recognize and call the hospital. It's better to be safe than sorry. And then if it's indigestion, if there's something else, that's perfectly fine. But if you have a heart attack, you can coming to the hospital early can save your life. So you shouldn't wait too long. And as soon as you think something is wrong, you should come to the ER.
Right. So I think one of the things that can be so scary about heart attacks for people is that we don't always know that it's coming. Um, it catches people off guard.
Yes.
And uh, is there any warning signs? You talked a little bit
Yeah.
about knowing like your history or anything like that.
Yes. Yes. I mean, we talk a lot about prevention and knowing your risk factors. So there are people who are in more risk factor. They are at increased risk of having heart attack. And risk factor include your age, especially elderly male or female. Male are at higher risk than female. And patients who have familial history of heart attack, they are at higher risk. And these are the non-modifiable risk factor. You cannot modify your age, you cannot modify your family history, you cannot modify your sex biologically. I mean, obviously, it's a controversial topic, and I don't want to go into that one. But biologically, you cannot modify your risk factor based on your gender. So these are the non-modified risk factors. So what can we do about it? There are other risk factors which can be modified. They include hypertension, which is your high blood pressure, hyperlipidemia, your cholesterol, which can be treated with medication, your diabetes, um, your smoking history, any drug use. And traditionally, obesity is not necessarily linked with heart disease. However, recent studies have shown that if you decrease your weight, it leads to improved cardiovascular outcome. So these are the things that we can do. And if you know that you have these risk factors, you should contact your doctor and help you modify those risk factors and treat those conditions so you can decrease your risk. And if you're already at higher risk and you develop chest pain or shortness of breath or even indigestion, especially with exertion, then talk to your doctor, and or if it's something bad, just come to ER.
So I think a lot of us probably know someone, either close to us or a family or friend who has had a heart attack in the past. What's your advice on preventions of reducing it from happening again um, for people who have already had one heart attack? How do they manage that moving forward?
So I'm big believer on prevention of heart attack, and the most important thing we can do is medical management for them. There are some very good medications that have shown consistently trials after trials to improve outcome, and most important of them is the cholesterol medication. If you lower your cholesterol, your bad cholesterol, which is called LDL, it should be less than 70. Ideally, it should be less than your age, but preferably less than 70. And that's what you should be targeting. Other things that you can do is control your blood pressure. If you already have a stent in your heart, it's very important, especially during the first year of the stent, to take your blood thinner, which is aspirin or clopidogrel or some other form of it, like Brilinta or Prasugrel. So it's very important that you take your medication for your stents. If you have diabetes, you should try to control your diabetes in conjunction with your doctor or endocrinologist. I mean, your primary care doctor or endocrinologist. Your target A1C should be less than 6.5. Ideally less than 7, but preferably less than 6.5. So you should control your risk factors. If you are smoking, you should quit smoking because that increases your risk for future heart attack.
Could you could you tell me why smoking increases your risk for heart attack? What does that
There
do?
Yeah, there are plenty of things smoking do. The nicotine by itself is toxic to the endothelium, which is in the vessel of the heart and all the arteries. And they also release like toxic chemical, which cause the constriction of the arteries. And when the arteries are damaged, they lead to increased cholesterol deposition and plaque formation, which lead to in turn closure of those arteries.
Okay, that's good to know. That is good to know. So I think we have a couple questions in our comments already. So let's just go ahead and run to that. So I have a comment here that says my cardiac CTA and echocardiogram, is that right?
Yeah,
My
echocardiogram.
echocardiogram is good, but I still have chest pain on exertion. Is it a heart attack that's not being picked up by tests?
So if you have a cardiac CTA and it shows no blockage, there are other reasons for chest pain, and they can be cardiac reasons and they can be non-cardiac reason. Sometimes you have small vessels of the heart that can give you some chest pain, and that can be treated with medication. Other non-cardiac reasons include muscle spasm, and sometimes you can have a clot in the lung. Sometimes you can have just the inflammation of the ribs or muscle, which is called costochondritis. So if you have normal CCTA, I mean stone cold normal, your risk of having a heart attack is very low in the next 10 to 15 years. And but you can have other reason uh, for chest pain.
Gotcha. And for some of those situations that may not be a heart attack but still have chest pain, is it important to see a cardiologist or should you talk to your primary care doctor?
It's important to see your primary care doctor and try to figure out what's causing the pain.
So the next question is, after someone has a heart attack, do they have to be on any specific medications like blood pressure medicine? What lifestyle changes do you suggest after a heart attack?
Yeah, we already discussed a little bit about it. It's important to be on when the patient gets the heart attack, we put them on few medication. Especially if they get a stent, we put them on aspirin and a sister of aspirin, either Plavix, which is clopidogrel, Brilinta, which is ticagrelor, or Prasugrel. One of these three medications, because you have a stent, it's a foreign body, and there's a risk of clot formation, especially during the initial period. So you will be on two blood thinner. You should be on a cholesterol medication to lower your cholesterol. If your blood pressure is high, it should be controlled, and there are a couple of medication that have improved cardiovascular outcome, which are either beta blockers or ACE or ARB. These are like two technical terms. I don't want to go into specific medications because they put you on that one, but it's uh, uh, important to control your blood pressure. Your target blood pressure should be less than 130 over 90. Your top number should be less than 130, and the bottom number should be less than 90. Your diabetes should be well managed. Uh, Tobacco, if you're smoking tobacco, that should be well managed. I mean, that should be stopped, not managed. And if you have any other risk factor, that should be taken into account. And uh, otherwise, you should access. There's a cardiac rehab program that we have at Memorial, and we send a lot of patients over there. And after the heart attack, we send almost every patient to that rehab program, and they gradually access your exercise capacity and start you on a program, and that increase your exercise capacity. So all these changes help improve your outcome after a heart attack.
Yeah, that cardiac rehab program is a great resource for people because it. I've never personally experienced a heart attack or recovering from a heart attack, but I feel that it would be a little bit scary moving forward and trying to recover. And you have that those people who are educated, well educated, and trained to help you learn how to
That,
recover at a great
true,
pace
true.
and that kind of thing. So
Exactly, that's a very great resource that we have over here, and they just monitor your heart rate and EKG when you're exercising initially. It gives patient the confidence, and it also helps us in management of future, like how what's the patient exercise capacities and how can we help them for going further.
yeah. Okay, we got three more questions here. Do you have any advice for people who become caretakers of a loved one after they have a heart attack?
The most important advice always is make sure they take their medications regularly and control the risk factors, which we already discussed, and live a normal and healthy life and exercise regularly, and just spend time with them, I guess.
Show them some love too. Maybe you send them a
Show them
Valentine's Day
some love.
card.
Yeah, I think that's a good thing. Yeah, show them some love based on our message for today.
Yeah. All right. What is the best diet to prevent heart attacks? Um, how many cupcakes can I eat every day?
I always say I never stop my patients from anything. I say everything in moderation. Obviously, you cannot have 10 cupcakes if it breaks your heart. I'm sorry. Uh, Everything in moderation. Increasing your vegetable intake, eating whole grain instead of white grain is better for you. Limiting your raw meat, which include meat, mutton, pork, or lamb. Decreasing that intake, it helps. Improving increasing nuts and polyunsaturated fat. That's Unsaturated fat increase your cardiovascular, uh, has improved cardiovascular benefit and decrease your cardiovascular event. So, but most importantly, at a certain point, these things have a very limited benefit, and mostly the medication that takes over, and they help you a lot with your cardiovascular outcomes.
All right. What about, are there any other diseases or health issues that can develop after multiple heart attacks? I guess something else.
I
Is
think
there a
the
consequence there?
I think the most important thing is, if you have multiple heart attack, your heart function will go down, and you will have a condition called heart failure. Luckily for now, we have a lot of medications for that, and for advanced heart failure, we sometimes refer patient for heart transplant or mechanical heart, which we call LVAD, left ventricular assist device. So, which we do not do at Memorial, but we send patients to either Houston or New Orleans for that. But after, that's the most important thing. Other issues that sometimes patient can have after repeated heart attack, they can form a clot in the heart, and that can cause a stroke, or pulmonary embolism, or they can throw a clot in the leg called limb ischemia. So it's very important to prevent further heart attack, take your medications, and modify your risk factors.
Here's another question. My son, his age is 14, complains of feeling pain in his heart sometimes for the last few years, but after a minute of pain, he says he's okay. Is there a particular reason that you can think of?
Young patients have a very low risk of coronary artery disease, especially that young. However, it's important to get it checked. Most commonly is benign, mostly musculoskeletal pain. Sometimes you can have what we call pruritic pain after infection. The lung pleura get inflamed, and you can have pruritic pain. So it depends on patient history. So it's better to get it evaluated one time and see what's going on. The risk of that, of your son having a heart attack, is very very low, and but still better get it checked and find out what's causing the chest pain, especially if it's been happening for quite some time.
Right. Now, this question may be another one that they need to speak to their doctor, but um, it says, I've been dealing with heart PVCS and occasionally PACS, but I've had a cardiac echo and CTA, and all were normal except for mild tri. Okay, I'm not a doctor here. This is why we have
Tricuspid,
to mild
tricuspid regurgitation.
tricuspid. Is that right?
Tricuspid regurgitation.
Yes, yes. Should I have more invasive tests?
So, PVCs and PSCs, everybody has some of them. Most of the time, if it's less than 10%, if your PVC burden is less than 10%, we just medically manage them. If it's bothering you too much, we can put you on a blood pressure. We can put you on medication called beta blocker that decrease your risk, that decrease the quantity of PVC. However, sometime if it's more than 10%, if or it causing your heart function to go down, or if you're very symptomatic with it, they what we do is, not we, the electrophysiologists, which they do is they go into the heart and just ablate that PVC, the area from where those extra beats are coming from. But if it's not lifestyle limiting, and they're not very high in, not high in quantity, like less than 10%, we normally just medically manage them. So it's important that you discuss that with your doctor, especially the heart doctor, and see if there's anything needs to be done for that.
Great. And I think this will probably be our last question we have time for. But this question says some people have used garlic to lower blood pressure and turmeric to thin the blood. Is there any benefit in preventing heart disease?
Yeah, my father believes in garlic and he takes it regularly. He takes garlic tablet. The data regarding garlic is not that strong. There are not enough studies to for me to conclusively say that okay, it has benefit or it does not have benefit. Uh, People, if it's working for you, fine. If it's not working for you, I normally don't prescribe it. I normally go by what we call evidence-based medicine, for which we have the evidence, for which trials are conducted. Most of the medications that we use have extensively been studied and they have been approved by FDA. However, the food supplements are not that well studied, and so we don't know exactly how much benefit they provide or what's the extent of benefit and what's the mechanism of benefit. Uh, However, garlic has been used as a remedy for hundreds of years, so I don't think there will be any harm in trying garlic, but I cannot say for sure like how much the benefit it is, and it's mostly because of lack of data.
Gotcha. So maybe, but maybe not.
Exactly. Your guess is as good as mine. So
Awesome. Well, thank you so much. I think that's going to conclude our discussion for today. Thanks again for visiting with us. And I know one thing I'm going to take away from this discussion is just knowing to be proactive about our heart health and not to just cross my fingers and hope for the best. And prevention starts today. So thank you so much for this. For any of you guys out there that are listening that would like to make an appointment with Dr. Awan, we have put his contact information on the screen here. And Dr. Awan, you see patients here at Memorial Hospital in Lake Charles, also at a clinic in Sulphur and in DeRidder. That's right.
yes, that is right. I go to Derrida on Tuesday and Sulphur on Friday. Monday, Wednesday, and Thursday, I'm at Memorial Hospital main campus.
Great. So, you guys that are watching, if you live closer to the DeRidder or Sulphur area and you'd like to make an appointment with Dr. Awan, he is there a little bit closer to you than having to drive to the big city of Lake Charles. So, all righty. Well, thanks so much. Is there anything else you'd like to add before we go?
That's pretty much it. I just want to thank you for having me here and also wish you best of luck for your podcast.
Thank you. Thank you so much. And if you guys enjoyed today's episode, just know that you can find a recording of all of our past topics, including some therapeutic Botox, cancer prevention, healthy eating, and so much more on our YouTube channel and on our website. So you guys have a very happy Valentine's Day. Send a card to someone you love and remind them to show their heart some love today as well. So, thank y'all.